Now to matters closer to home. And this past week, we saw a number of extravagantly remunerated public servants receive Queen's Birthday honours for simply doing their job. Some may argue for doing their jobs poorly. COVID catastrophists, including New South Wales Chief Health Officer Dr Kerry Chant and former Queensland Chief Health Officer and current Queensland Governor Dr Jeanette Young, were among those honoured for their contributions. Now, shouldn't these awards be going to hardworking volunteers who are quietly devoting their life to helping others? Not public health bureaucrats like Dr Young, who you'll remember was the country's most impactful anti-vaxxer, who as late as June 2021 was warning Australians under 40 not to get the AstraZeneca's jab, saying she didn't want an 18-year-old in Queensland dying from a clotting illness. Jeanette Young also banned Anzac Day flyovers in the name of COVID safety and advised Brisbane residents in January 2021 to wear face masks when driving in their own cars, even when alone. And that rule was only changed after much mockery from the public. But instead of being demoted, Dr Young, who earned around $600,000 per year as the Chief Health Officer, well, she was promoted to the plum role of Queensland Governor. And she can now add the honorifics AC to her name. Also on the honours list was the man who first uttered the infamous "it's not a race" line about Australia's vaccine rollout, Health Department Secretary and former Chief Medical Officer of the nation, Professor Brendan Murphy. Now, Scott Morrison would bitterly regret repeating that foolish line, but the man who the then Prime Minister was dutifully reiterating was among those to receive the country's top honours by being appointed the Companion of the Order, just like Jeanette Young. Now, that's the same Professor Murphy who made a spectacle of himself in April this year when he failed to answer the simple question, what is a woman?
I think there are a variety of definitions, and I think
just a simple
perhaps to give a more fulsome answer, we should take that on notice.
You're going to take on notice the question of what a woman is.
No, well, there are a variety. It's a very contested space at the moment.
No, not a contested space. Fairly simple definition for what a woman is. Now, New South Wales Chief Health Officer Dr Chan, she received an AO, one rung below an AC, for her distinguished service to the people of New South Wales through public health administration and governance. Compared to her counterparts in Queensland, Victoria and South Australia, Dr Chant was a standout, but one cannot forget her imploring people in New South Wales not to say hello to neighbours even when fully masked. Australia's honours system has become hopelessly politicised, and there needs to be a complete overhaul in how these awards are granted. One small mercy was that this year, Victoria and South Australia's respective Chief Health Officers did not receive gongs. Can you imagine the unintentional comedy that would ensue if Dr Brett Shut the Playground Sutton and Professor Nicola Pizza Box Spurrier were awarded an AO or AC? Dr Spurrier did receive a Public Service Medal last Queen's Birthday, despite her bizarro advice to fans attending a Crows Pies game not to touch the footy as it could have germs from those diseased Victorians in the Collingwood Football Club. And who can forget her decision to plunge South Australia into lockdown over fears that someone had caught the virus from a pizza box? Yes, that really happened. But try as they might, no Chief Health Officer in the country could top Victoria's Dr Sutton for sheer ineptitude and hysteria. After all, Melbourne had the great dishonour of having the world's longest lockdown, with its citizens subjected to a wide range of indignities, including curfews, 5-kilometre travel limits, playground bans, golf bans, boating bans, just to name a few. And of course, there was this, the absolutely illiberal and disproportionate overreach that Victorians were subjected to from police enforcing public health orders. We're beginning to see some of the devastating impacts of lockdowns, restrictions and closures, from missed early diagnosis of serious illnesses like cancer, to an increase in mental health issues, to livelihoods destroyed. Not to mention the grim consequences of school closures and distant learning. All of it entirely predictable. What we need is a royal commission into the country's and each state and territory's COVID response, not more accolades for unelected health bureaucrats.
Fantastic. Thanks, Rita. You're right. If royal honours are good enough, so for this mob, so is a royal commission.